Anatomy 32, Chapter 22, the Endocrine System. Topics: pancreas, ovaries, and testes. So the pancreas. Pancreas is a organ that is found in the upper abdominal area. It is located posterior to or behind the stomach. It bumps up next to the duodenum of the small intestine and stretches all the way to the spleen. Within the pancreas are these interesting pancreatic islets, and within these pancreatic islets are 4 cells that produce 4 different hormones that respond to blood levels of glucose. The pancreas, therefore, is observing the bloodstream and the blood levels of glucose to determine when to release these hormones, and so it acts independent of the pituitary gland. Also worth noting, there's also this exocrine tissue because the pancreas is also part of the digestive system. All right, first hormone is glucagon. Glucagon is released when there are low glucose levels in the bloodstream. So glucagon will act to raise glucose levels in the bloodstream. It does this by accelerating the breakdown of glycogen. Glycogen is how our body stores glucose in the cells, especially the liver and muscle cells. Glycogen is made up of long chains of glucose molecules, thousands and thousands of glucose molecules per glycogen. So it accelerates those breakdown of glycogen and then increases glucose release into the bloodstream, since now there's more glucose that the cells can release. Then there's insulin. Insulin is released when there are high levels of glucose in the bloodstream. So insulin's job is to lower blood glucose levels. It does this by increasing glucose transport into cells, such as muscle cells, liver cells, adipose tissue, and increases glycogen production. So it has those cells then take the glucose and make glycogen, which again is long chains made up of glucose molecules. You can have thousands and thousands of glucose molecules per glycogen. Third hormone is somatostatin. This is released when glucose levels in the bloodstream are normal, and it inhibits the secretion of insulin and glucagon. So somatostatin is released when glucose levels are normal, and it inhibits the release of glucagon and insulin. And then the fourth hormone is pancreatic polypeptides. Pancreatic polypeptides are released when glucose levels are abnormal, either high or low, and it inhibits somatostatin. So pancreatic polypeptides inhibits somatostatin when glucose levels are abnormal. Somatostatin inhibits glucagon and insulin when glucose levels are normal. So how does this all work? Well, here are the 4 hormones produced by the pancreas to control blood glucose levels. Which hormones would be produced if the blood glucose levels are normal? Give you a second to think about it. Maybe 2 seconds, maybe 3 seconds. You can always pause if you need more time. Well, what you'd expect is only somatostatin to be produced. You would not have glucagon produced, you would not have insulin produced, and you would not have pancreatic polypeptides produced. So here's another way to diagram it. Pancreatic polypeptides are inhibited. They are not produced. They're inhibited because blood glucose levels are normal. Somatostatin is stimulated. It is produced because blood glucose levels are normal. And because it's produced, it inhibits insulin and glucagon. Also, the blood levels of glucose, being normal, also inhibit the release of insulin and glucagon. So these will not be produced. This will not be produced, only that. All right, what hormones would be produced if glucose levels are high? There's a high level of glucose in the blood. Well, it would look something like this. The glucose levels are abnormal, so we would get pancreatic polypeptide produced, which then inhibits somatostatin, which then allows insulin to be released because of high levels of glucose. So again, in our diagram, blood glucose levels are abnormal. This stimulates the production of pancreatic polypeptides. Pancreatic polypeptides then inhibit somatostatin, so stops somatostatin from being produced. The blood glucose levels are high, so that will stimulate the release of insulin. And because blood glucose levels are high, glucagon will be inhibited. It will not be produced. So you only get these two hormones produced for high levels of glucose. All right, and then what hormones would be produced if blood glucose levels are low? Again, blood glucose levels are abnormal, so pancreatic polypeptide is produced, inhibits somatostatin, and since blood glucose levels are low, that would lead to the production of glucagon. So again, abnormal glucose levels stimulates the production of pancreatic polypeptides. This hormone then inhibits the release of somatostatin, prevents somatostatin from being produced. Then, because blood glucose levels are low, that will stimulate the production of glucagon. So glucagon production stimulated from low glucose levels. And because blood glucose levels are low, that will inhibit the release of insulin. No insulin produced because blood glucose levels are low. All right, disorder associated with the pancreas is diabetes mellitus. That is the inability of the body to use or produce insulin. There are two main types of diabetes mellitus. There's type 1 diabetes. In this type, a person's immune system destroys the cells that produce insulin. So that person's own immune system destroys the cells that make insulin, and therefore insulin has to be injected into the person when they need it. Type 2 diabetes is caused when the target cells in the body become less sensitive to insulin. So as we know, insulin will bind to target cells, causing them to increase the uptake of glucose, pull glucose out of the bloodstream. However, in type 2 diabetes, those target cells become resistant to insulin. So it takes higher levels of insulin hormones to cause the same effect. Eventually, the amount of insulin needed to be produced to lead to the proper effect is too high. The pancreas just cannot produce enough insulin, so the person starts to experience the symptoms of diabetes. Diabetes has a variety of symptoms. People don't necessarily have all of these symptoms. Can be blurry vision, increased thirst, or need to urinate as a way to try to get rid of excess glucose. Feeling tired or ill, recurring skin, gum, bladder infections, dry, itchy skin, unexpected weight loss, slow healing cuts and bruises, loss of feeling or tingling in the feet. Again, these are just some of the possible symptoms, and you don't have to have all these symptoms to be someone who has diabetes. And of course, if left untreated, diabetes would eventually lead to that person's death. So it has to be treated once the person is diagnosed. All right, the ovaries. Ovaries produce a few hormones. It produces the sex hormones, estrogens, and progesterone. And these hormones regulate the female reproductive cycle, help to maintain pregnancy, and promote the development of female secondary characteristics during puberty. And we will go into more detail about the hormones produced by the ovaries when we cover the reproductive systems. Another hormone produced by the ovaries is relaxin. Relaxin increases the flexibility of the pubic symphysis during pregnancy. So the pubic symphysis is that cartilaginous joint that connects both right and left os coxae or hip bones. And so having that a little more flexible will aid in the delivery of the infant. Relaxin also helps dilate the uterine cervix during labor and delivery, which is also important to have happen so that the cervix dilates, increases its space to allow the infant to pass through. And then third hormone category is inhibin. Inhibin inhibits secretion of follicle-stimulating hormone by the anterior pituitary gland. So if there's no need for the stimulation of the release of another oocyte by the ovary will produce inhibin, which then suppresses the release of follicle-stimulating hormone by the anterior pituitary gland. Testes also produce a couple of hormones, one being testosterone. Testosterone has a variety of functions. It stimulates the descent of the testes in the fetus. It helps to regulate sperm production, and it promotes the development of male secondary characteristics during puberty. And the testes are also able to produce inhibin, which, as mentioned before, inhibits the secretion of follicle-stimulating hormone by the anterior pituitary gland. So testes are producing plenty of sperm, don't need that stimulated, releases inhibin that then suppresses the release of the follicle-stimulating hormone. As mentioned at the beginning of the lecture, there are a variety of other structures that produce hormones that at least have cells within them that would be considered endocrine cells, even though these structures are not considered part of the endocrine system. So for instance, the heart can stimulate the kidneys to produce more urine. Producing more urine is pulling extra water out of the bloodstream, which would then lower blood volume, which would then lower blood pressure. Gastrointestinal tract has a ton of different hormones it produces to regulate its own functioning. The placenta secretes hormones to prevent the uterus from being sloughed off. So basically, the placenta produces hormones that say, hey, there's a pregnancy here. We need the uterus's lining to stay intact. The kidneys release the hormone renin, which regulates blood pressure, and the hormone erythropoietin, which stimulates erythrocyte production. So erythropoietin will cause a greater production of red blood cells. And then the skin is able to produce the hormone precursor to vitamin D because of exposure to UV light. So why it's good to get some sun exposure. And then vitamin D, when it's finally completely formed and is functional, aids in the absorption of calcium by the small intestines. All right, and that is it for chapter 22.